Hey y'all, April Green here, registered nurse at CSC. Today we're going to be talking about a rhinoplasty, but if you haven't already gone and watched the general surgery information video, go ahead and do that first before you watch this. So the items that you'll need at home is your lab work and your prescription medications, which will give you all of that stuff at your pre-op. You'll also need some hydrogen peroxide and Q-tips to clean your nose with. Also Afrin nose spray, gauze sponges, about 4x4s, 1-inch paper tape, a bag of frozen peas, and small Ziploc snack size baggies. You'll also need to wear a zip up or button up shirt that we can put you in after surgery. And we want you to shampoo your hair the night before and the morning of your surgery. And don't use any hairspray or hair gel. We also want you to clean your face the morning before surgery really well, and also don't apply any moisturizers, makeup, anything like that. And don't forget to bring your pain and nausea medication with you to surgery. So now we'll start talking about post-op teaching. You will restart your antibiotic medication and your Cosmetic medication whenever you get home from surgery with like a light meal to avoid any nausea. And you'll sleep in a semi-sitting position for about 3 to 5 days following surgery. So that can be propped up on a couple pillows or in a recliner, whichever is more comfortable for you. You do want to try to suppress any forceful coughing, blowing of the nose, or sneezing for about a week or two if you can. You will notice some bruising and swelling that may occur in the surgical area and kind of around your eyes. If that happens, it should be gone within 1 to 2 weeks. And then most swelling should be gone in 2 to 6 weeks. But just remember that your nose can take about a year to achieve its final appearance. You might have a low-grade fever after anesthesia. It's not completely abnormal. If you do notice that you are having this, take some Tylenol, increase your water intake, and if it doesn't go below 101.5 after that, then give us a call. We do want you to keep an ice pack, which is actually going to be those frozen peas in that Ziploc baggie, on your eyes and nose for about 12 hours after surgery. If it's getting too cold, you can kind of place like a Kleenex under it. And you can also take breaks if you need to, so like 15 minutes on, 15 minutes off. Just remember to not get the splint or the nasal dressings wet. You'll have a little thing we call a nasal drip pad, and all it is just a little gauze sponges under your nose to catch any of that blood that's gonna kind of drip for about 12 hours after surgery. You'll keep wearing that, and you'll just change it about every hour for about 8 to 12 hours. If it's kind of just saturating every 30 minutes, can't really keep up with it, just keep saturating, then give us a call. You shouldn't see any of that. Then for about the first 10 days, you want to avoid any straining or bending over to lift things, which helps prevent swelling, bruising, and more bleeding. Also avoid excessive sun exposure, or really any sun exposure if you can avoid it, because it can cause swelling in about 5 to 10% of patients. Don't drive and take your pain medication. If you do wear contacts, you can start wearing them about 2 days later, or whenever your swelling subsides. Your nasal splint will be removed in our office about 5 to 7 days after surgery, so don't mess with that at all, the splint part. We'll take care of that. But after we do remove that, you'll be given a metal splint that you can wear if you have to wear eyeglasses or sunglasses, because we don't want that pressure distorting your nose at all. And that's about 3 months you'll have to do that. You can do some walking and light activity about 48 hours after your surgery, but no strenuous exercise such as working out, running, weightlifting for about 4 weeks after surgery, and definitely no contact sports, basketball, football, volleyball, soccer, for about 3 months after surgery. You might notice that your nose feels really congested, and that can be normal for about 4 to 8 weeks after surgery. Due to internal swelling. So head elevation and avoidance of a lot of salt in your diet can help with that. Now we're going to talk about nasal packing and how to remove that. So you're gonna want to remove that nasal packing inside of your nostrils about 24 hours after surgery. And how you're gonna do that is you're gonna assemble the following: a chair, tweezers, nasal spray, the Afrin kind, tissues, a wastebasket, and a mirror. So while seated in your seat, you're going to saturate each foam sponge with that Afrin nasal spray and tilt your head back for 5 minutes to moisten the foam for easier removal. And then you're going to look in the mirror, grab that foam with your tweezers, and in one continuous motion, you're going to pull out the foam piece. So then of course you're going to repeat it on the next side, on the other side. And any prolonged heavy bleeding past 15 minutes is very unusual after. So if you notice any of that, definitely give us a call and control that bleeding with the Afrin nose spray. You might have like a couple little drops after, which is normal, but anything excessive, give us a call. Now we're going to talk about nasal cleaning. So it should be started after the sponges are removed. So clean inside the nose twice a day with the hydrogen peroxide soaked Q-tips. You'll occasionally get large, like dried crust of blood out, which is normal. If you notice that your nose keeps like smelling kind of funny or bad, then you're gonna increase your cleaning to 4 times a day. And then if the odor still persists after that, then give us a call. So let's go over that again. Clean the inside of your nose twice a day for that first month, and then the next month, just once a day is okay. And that's really it, y'all. There's some more information in this packet that will give you going over the consents that you'll sign at your pre-op, some of the medications to avoid, a big list of them, and the Cosmetic and how it helps with speeding up recovery. So that's all in there for you that you'll get at your pre-op. So can't wait to see you guys. Thanks.